diarrhea, depression, bone and or joint pain, fatigue, canker sores on the inside of the mouth, itchy skin rash, These are only some of the symptoms of celiac disease found in adults. Approximately 1 in 133 Americans, or about 1% of the population, is diagnosed with celiac disease, while it is estimated that 83% of the population is undiagnosed or misdiagnosed with other conditions. Contact your nearest doctor to get screened and get the facts today. Living with celiac disease is a fight that you don't have to fight alone. In order to understand celiac disease a little better, let's briefly go over a starch molecule from ingestion to absorption. In the first step, the starch is mechanically digested by chewing. Next, salivary amylase in the mouth further breaks down the starch molecule. Propulsion by the esophagus then pushes the starch molecule down into the stomach. The molecule is mechanically digested in the stomach and then reaches the small intestine. In the small intestine, chemical digestion breaks down the food molecule via intestinal amylase. This is accomplished by amylase in the lumen and brush border enzymes which finish digestion to simple sugars. Absorption is then completed by finger-like projections known as villi that are located in the small intestine. Without villi, the absorption of nutrients would be very difficult, which leads us to the topic at hand, celiac disease. Celiac disease is a genetic autoimmune disorder where the ingestion of gluten leads to damage of the villi located in the small intestine. This damage leads to difficulty absorbing nutrients, which eventually leads to long-term illness. Some symptoms of celiac disease include diarrhea, bloating, gas, fatigue, iron deficiency anemia, osteoporosis, skin rash, malnutrition, weight loss, depression, and anxiety. Although celiac disease is chronic, treatment can often help. People diagnosed with celiac disease are instructed to follow a strict gluten-free diet. Gluten is a protein found in foods containing wheat, rye, and barley. Examples of such foods include bread and beer. Most people diagnosed reported symptom improvement within a few weeks of following the diet. However, intestinal repair could take up to several years. Ingesting any gluten could reverse the repair, and the symptoms could therefore re-emerge. Celiac disease may not currently have a cure, but steps can be taken to avoid further complications.